You know that feeling? The weight of academic pressure? It's way more than just a little stress, right? So, what's really going on in our minds when all that pressure starts to build up? Well, today we're going to dive deep into the science connecting school stress and depression. And even more important, we're going to unpack a practical, science-backed toolkit you can use to fight back and build up that mental strength.
Okay, let's just start with a number, because this one really puts it all into perspective. 31.7%. Wow. That's the percentage of adolescents who reported symptoms of depression in a huge recent study in Vietnam. Now, yeah, this data was collected during the extra stress of the pandemic, but it really shines a massive spotlight on a critical issue that students are facing pretty much everywhere.
So to really get to the core of this, we're going to look at a study that surveyed over 1,300 students. And, while its focus was on Vietnam, let's be real, the experience of academic stress, that pressure from exams, homework, all those expectations, that's something students all over the world can relate to.
And what's so powerful here is just how clear the finding is. I mean, this isn't just a theory. Study after study confirms a direct link. It's kind of like a set of scales, right? As you pile on the academic stress on one side, you can literally watch the symptoms of depression and anxiety rise up on the other. It's a really foundational piece of this whole puzzle.
But how exactly does this happen? It's not like stress just flips a switch and suddenly there's depression. No, there's a kind of hidden psychological pathway at work here, and it involves two absolutely crucial factors that basically determine whether we bend or break under all that pressure. All right, so the first key factor is something called resilience. And honestly, the best way to think about it is like a mental shield, or maybe an internal shock absorber. It's just our natural ability to bounce back when things get tough. When we face a setback, it's our resilience that helps us get back on our feet and just keep going. And this is where it gets really interesting. The research shows that academic stress isn't just a direct attack. It's also doing something sneaky. It wages this second front assault, where it actively chips away at our resilience. It weakens that mental shield we were just talking about, leaving us way more vulnerable and making it so much easier for those depressive symptoms to get a foothold.
Okay, so the second key factor here is life satisfaction. And this isn't just about, feeling happy in the moment. It's bigger than that. It's your overall big picture view of your life. It's that deeper feeling of contentment you get when you can step back and say, you know what, on the whole, my life is pretty good.
So here's how all these pieces click together. Life satisfaction, it acts like a powerful ally. The study actually calls it a moderator, which is just a fancy way of saying it actively strengthens our resilience. Think of it this way. Having high life satisfaction is like adding another layer of armor to your mental shield. It just makes that shield way more effective at deflecting all the stuff academic stress throws at you. Okay, so this brings us to the big question, right? The most important one. If we know that this strong shield of resilience, beefed up by life satisfaction, is what protects us, well, how do we actually build it? How do we go from just understanding the problem to, actively fixing it?
And this is exactly where we pivot. We're going to shift from the what to the how. We're going to explore a proven, really practical method for building up that mental armor. It's basically a toolkit for your mind that anyone can learn to use, and it's called cognitive behavioral therapy, or CBT.
Let's just break down that name for a second because it tells you everything you need to know. Cognitive, that's all about our thoughts, right? The stories we tell ourselves. And behavioral, that's about our actions, the things we actually do. So CBT is built on this really powerful idea. We can change how we feel by changing how we think and what we do.
So here's the core idea. Depression often works in what's called a vicious cycle. Picture this. It starts with a negative thought. Maybe, I'm definitely going to fail this test. That thought makes you feel awful, right? Sad, hopeless. And because you feel so bad, you decide to just stay in bed and not study. That's the action. And what happens then? Well, that action just proves your original thought right, and the whole cycle spins faster and faster, pulling you down.
But here's the good news, and it's really good news. We can absolutely break out of that cycle. We can jump in at two key points, our thoughts and our actions. So let's look at some super specific, practical strategies for doing exactly that. First up, let's tackle the thoughts. The CBT manual calls these mistakes in thinking, which is a great name for them. You've probably done these. Like all or nothing thinking. You get a B on a paper and suddenly you're a complete failure. Or the mental filter. You have an awesome day, but you obsess over that one weird comment someone made. Seriously, the first step is just noticing when your brain is doing this stuff.
Okay, now for the other side of the coin, our behavior. And this quote just hits the nail on the head. When we feel down, what's our first instinct? To pull back, to do less. But that inaction, it's like fertilizer for depression. It creates this vacuum where all those negative thoughts can just grow and grow, which, you guessed it, makes us want to do even less. It is such a powerful trap.
So how do you escape that behavioral trap? With a strategy called behavioral activation. I know, it sounds super clinical, but it's actually dead simple. You schedule positive, pleasant activities, and you just do them. The key part? You do them especially when you don't feel like it. We're talking small things here, taking a walk, putting on some music, calling a friend. The action has to come first, and the better feelings will follow. It's like kickstarting an engine.
All right, let's tie all of this together now. We started by looking at the problem the research uncovered, right? How stress just hammers away at our mental defenses. And now we've just explored this amazing CBT toolkit for building them right back up again. So let's just put it all side by side, nice and clear. Problem 1, academic stress weakens our resilience. The solution? We use those cognitive tools to challenge the negative thoughts that chip away at our confidence. Problem 2, stress is linked to low life satisfaction. The solution for that? We use those behavioral tools, scheduling pleasant activities to actively rebuild our sense of well-being. See, it's a direct line. For each problem, there's a tool.
And here is the most crucial takeaway of all. We are not powerless against stress. Not at all. This isn't just about coping or getting by. It's about building. By consciously changing our thoughts and our actions, we can literally forge the resilience and life satisfaction we need to protect our mental health. This allows us not just to survive academic pressure, but to actually thrive in spite of it.
So that leaves us with one final thought to take with you. It's so easy to look at all this and think it's some huge project, but real change always starts small. So just think about your own life, your own pressures. What is one small, totally manageable step you can take this week? Just one. Either to challenge one of those mistakes in thinking, or to schedule just one pleasant activity.
Health is the most precious gift. If this video helped you or someone you love, please like, subscribe, and share so more families can stay safe and healthy.